members of the Coronavirus Children's Resiliency Collaborative together to talk about a few issues before the media and really to get some of these issues out there. We have a good group who's speaking this morning at this virtual press conference, which is a new thing for us, but we're excited to try it out. I'm Bob Sanborn, President and CEO of Children at Risk. After me will be Juliet Stipeche, who's with the City of Houston Mayor's Office. Following her, the Superintendent for the Houston Independent School District, Dr. Renae. Brian Greene will be joining us from the Houston Food Bank. Dr. Melanie Johnson, who is the CEO of the Collaborative for Children, a focus on early education. Steve Ives is with us. He is the CEO of the YMCA. Colleen Dippel, who is the CEO of Families Empowered, an education and parenting group. Renae, Vania, Tomczak, she is the president of Mental Health America, Houston. She'll be joining us. Dr. Tiandra Gordon, who's the director of the school-based behavioral health at Legacy Clinic, Legacy Health. She'll be with us today. And then we'll follow with Yael Ross, who's the director of our Center for New American Children at Children at Risk. And she and I will speak in Spanish around some of the issues around immigrant children in the Latino community. As we get going, I think a lot of thanks are in order for the team that's putting this together, but also during this coronavirus crisis, health workers, early education teachers, grocery workers, teachers who are online really doing the best that they can, doing a fantastic job. The nonprofit community has really risen, and we want to thank them, all the volunteers, parents who are teaching their children for the very first time at home all day long, which is a challenge in and of itself. And I want to also thank the many public leaders that are doing their very best to help us ride this out during this crisis. Some of the public leaders, we say, bless their heart, they're trying so hard. But by and large, what we see are some fantastic efforts being put in by everyone engaged around this. A couple of key points that today as we address the press and others. One is that as we look at our families here in the Houston area and all across Texas, what we do realize is that low-income families are disproportionately negatively affected. And we put up two maps of the greater Houston area. This is Harris County. And our researchers at Children at Risk went to work on these maps, and they really created two different types of maps. One is looking at the highest concentration clustering of child poverty, and then we added the lack of online learning access and then poor schools. And what we found is a certain number of neighborhoods that were being significantly adversely affected. The second ward in Houston, the North Side, North Line area, Greater Greens Point, Brayburn, and the greater OST South Union neighborhoods, where those kids are having a very tough time when it comes to education and online learning. The second map is around the Fifth Ward, El Dorado, Oates Prairie, Setagast, Independence Heights, East Houston, Greater Greens Point, Brayburn, Gulfgate, Pine Valley, and Magnolia Park. This is where we saw a high concentration, a clustering of social vulnerability in regards to food. Those that overwhelmingly qualify for free reduced lunch and can no longer access these due to school closure. We want these maps to be available, and we want people to understand that there are certain neighborhoods that we absolutely need to focus on because these kids are really falling behind. And that gets me to a couple of our other points. When we look at public education, we've heard from our collaborative that not only are we going to see this year summer loss, but this year we're going to see pandemic loss. And when you compound that loss, what we see is there's going to be overwhelming loss of learning for low-income kids. Kids are going to be falling behind, possibly by as much as a year or more. And when we look at that, not only is it bad for those kids, but it's bad for our economy now and into the future. We saw one proposal from the Secretary of Education in Washington, D.C., where she said, maybe we should be doing small investments in specific students. What we're saying is we need to see investments in the way that people are doing online learning, making sure that we have internet access in those neighborhoods. Our companies doing their share in terms of making the internet free for low-income families. We understand that many of these families have smartphones, but do they have the data plans? Can we give those families free data plans? Can we make sure that there's technology that they can use for online learning? These are some of the important things that we need to be working on. We know that the Houston Independent School District, and Greene will address this in a little bit, has done an excellent job. We're much more interested to see how others are doing around that area as well, because we see many kids falling behind. One of the public policy things that we want to focus on also is that because of this loss of learning, we're going to ask that the school year start August 1st for everybody. We know that some districts are already talking about that. Can we start August 1st, providing that the coronavirus crisis has been abated by that point? But can we start August 1st? And might we add 40 extra days to the school year, a longer school year next year? These are things that we have to explore and that we really want to see happen. Longer school year, earlier start date for our schools. Another key topic I want to talk about is our immigrant community. And Yael, Ross, and I will talk a little bit about this a little bit later in the press conference in Spanish. But we have to understand that there's a fear in our community, regardless of status, but certainly in the Latino and the immigrant communities. They're fearful of, if they seek help, is it going to adversely affect their status? And our public officials need to guarantee the safety of our citizens. And that means saying that you can come forward regardless of your status and nothing will be impacted by that. We are not going to go after you. And we know that the mayor and the county judge are happy to make these pronouncements, but we need to see it from our governor. We need to see it from our president saying that this is a public health effort. We need to come forward and we need to say it's better for everyone's public health if we say that every single person who resides in our country, regardless of their status, that they can seek health and nothing is going to happen. That's very, very important that we see this and hear this from our leaders. We've heard a lot, third point, we've heard a lot around food and food insecurity issues. We know that the U.S. Department of Agriculture has been one of our greatest allies whenever there's been a disaster. In this region, they have been stupendous. And so we want to make sure that we can continue to lean on them for any waivers necessary so that those school services, those food banks, everyone who's providing food does not lose money when they're trying to provide food. Right now, we see some school districts that are saying, if I produce so much, I will lose money. We don't want to see that happen. We want to make sure that everything is weighed so that we get enough food into the hands of our families and in our children so that hunger doesn't happen, so that food insecurity doesn't happen. Brian Greene will join us in a little bit to talk about that. And then the fourth point I want to make is around early education. For our first responders, those people that have to be out there, we need places, they need places to put their kids. And while Melanie Johnson, Dr. Johnson will talk about this in a little bit, one of the things that we're asking is that people understand that there's a lot of goodwill out there in terms of opening up pop-up childcare centers. But indeed, our current early education centers, our current early learning centers are available. They would like to see this income. They would like to see these children. They are the trained professionals. We want to make sure that they are addressed first before we start opening up some of these emergency centers. This is a significant time for us when it comes to families and especially to children. And we want to make sure that we address this. And this collaborative of 60 odd organizations in the greater Houston area has come together to say, what can we do to stand up for public policy to make sure that these families and these children are heard and that we're addressing the needs? The needs are substantial, and we need to do whatever's necessary to make sure that these families can be successful. So next up, I want to bring in from the mayor's office. The mayor's office has been stupendous as part of this collaborative. Juliet Stipeche is with us. She's with the City of Houston Mayor's Office, Mayor Sylvester Turner. Juliet, thanks for being here. A few words.
Yes, thank you so much, Dr. Sanborn. That was a fantastic introduction. The Mayor's Office of Education has been working very hard in terms of collaborating, coordinating, and communicating amongst the various educational entities, from government entities to nonprofits. We thought things were challenging after Hurricane Harvey, but the COVID-19 pandemic has demonstrated something that I think is truly novel and unique for everyone. And so we have looked at 5 key areas to try to rally this collaboration, communication, and coordination plan, looking at the area of food and nutrition, which is extraordinarily complex. But we know that children need food and nutrition, especially given at this time where the schools are closed, and those serve as the greatest resource both for learning and social supports for our children and our community. Two, we're looking at childcare and trying to develop a plan for essential government employees, as well as first responders, healthcare providers, and persons that need to continue to work to allow people to have access to essential critical resources at this time. Three, we've been looking at digital learning and remote learning, and that has been something that has been amazing. There are tremendous amounts of resources, but as Dr. Sanborn said, there are children that don't have computers, and there are children that don't have access to Wi-Fi. So it's rallying and critically framing this information, understanding the data that's available from the community to be able to create plans in which we're able to get resources to those that need it most. Finally, in the area of health and mental health, we know that children in this area have already been a lot due to Hurricane Harvey. Now we have another emergency crisis situation in which they're going to need a lot of support from us. And so we've got some amazing partners who are developing plans to assist children during this time of stress. And also parents and teachers and others need that support at this time with the challenges that are going on. And finally, the mayor's office is also looking at other resources that exist in the community, non-learning resources to help support our families. And so I just want to first say, thank you, Dr. Sanborn, for this collaboration. Thank you for everyone that is on this call. But most importantly, I also want to say thank you to the community, everyone who has been following the stay home, work safe order, who has been making sure that they engage in social distancing and other practices to ensure that our community is safe. We are in this together. We are Houston Strong. And together, by coordinating the vast resources that we have in this very diverse, beautiful community, will we be able to get through this together.
Thank you very much, Juliet. I wanted to ask you one question before we move to Dr. Lathan. This Mayor Turner, has been so committed to these communities that are suffering the most, right, because of this low income. What is the biggest worry for you and the mayor when you see these communities and their access to internet, their access to food? What becomes the biggest worry for you guys in the mayor's office?
So we have been focusing on the issue of equity or inequity, and we've been very successful in terms of mayors' complete communities and being able to utilize data to understand what's happening in these communities that have been traditionally underserved for many, many years. It is going to take a tremendous effort of everyone working as quickly as they can. This has been an issue, I think, that has been slow in some instances, but that this crisis has brought the inequity to the forefront. We are a community that is extraordinarily resource rich, but we do have areas that are grossly underserved. And so it's you talked about there are waivers that need to be waived. There are structural barriers that exist that need to come down. And so we have to really rethink what our society needs to do to ensure that there is equity for all children. And it is now a public health crisis. Health and education and their well-being are all tied together. And we have to work with private companies, the nonprofit entities, and the government entities to determine the deliverables that can be provided now. And we have to work with all expediency possible. And so I just, these opportunities for us to come together to share best practices and also have the experts provide recommendations is critical for us to be able to develop longstanding policies that will impact our community in the future as well.
Juliet, thank you very, very much. Send our regards to the mayor. This is the time. We see you guys working so hard, and we thank you very, very much for your leadership, for you and Mayor Turner. Thank you very much.
Thank you so much.
Next up, I want to bring the superintendent of Houston ISD, Dr. Greene Lathan. Dr. Lathan has been working overtime with her team to get us where we need to be in regards to children and schools. This is a trying time for our schools. And so let's go ahead and bring on Dr. Greene Lathan. Did she just leave? Okay. Well, we're having technical difficulties. Not surprising. This is the first time that we've done this. Let's move to Brian Greene. Brian Greene is with the Houston Food Bank, and food has been a big issue for us. And so let's go ahead and bring Brian Greene on, my good buddy Brian Greene. Brian, how are you? You are at the food bank day in and day out. How is your team adjusting to all of this, by the way?
Well, this is very different than even a hurricane. What has made Houston, frankly, so successful at being able to channel surplus food to families in need at levels no other community can do is our ability to rally the community and throw volunteers at any problem. So even normally in a disaster situation where we can have many hundreds all the way up to over 1,000 volunteers working at once, we can't do it right now. So everything is so much harder. We're used to juggling. We can't control the supply. We can just how much we say yes to, what partners are open, how much can they do, the logistics of getting it to it, what work we have to put into it, and everything is just so much harder this time because of all of both the resource constraints and just the social distancing to makes it so fewer people can be working in any given area at one time. It's working surprisingly well. Houston Food Bank and our partners, we're distributing now 50% greater than normal plus, all the way some days are 2 times the normal amount. But it is a much bigger challenge. Want me to go into my regular comments now? Uh-oh, did I get cut off?
No, you're on, Brian. Go ahead into your regular comments. Yes, now you're in press conference mode.
Now I'm in media conference mode. So even in the best of times, children are the most likely to live in households that are food insecure, the most likely to live in households that go hungry, and summer normally is the worst time for that, and it's not because of the season, it's because that's when the schools are closed. Now we throw on the economic impact of the pandemic on top of that, and this is a very tough time for children. Fortunately, there's a lot of work going on, but one of the bigger challenges is normally we would make up in the summer for the lack of food in the schools. The kids would go to congregate meal sites. Many of the schools offer those. Many partners, such as the Boys and Girls Clubs and YMCA, they're offering these congregate feeding. Well, we can't do that now. So even the efforts that we do, they're so much more challenging in order to get enough food to try and make up that difference. Most of the school districts, they're doing something, but the scale that they can do it is just limited, as they're providing either one meal at a time or just meals for the kids. The partners, we've moved to grab and go and drive-through systems where it's very low contact doing that work. Houston Parks and Recs has their sites up and running where they're providing a meal at a time. So most of our partners are open. There is a lot of good activity going on. Please be patient. These are generally volunteers that are working to make this happen, and it is overwhelming circumstances. The vast majority of sites that open up immediately have very long lines, seeing unprecedented demand everywhere we go. If you I do recommend that any school, whatever school district you're in, go to their website, see what they are doing to offer services to your kids. You can go to our website, houstonfoodbank.org. We keep that updated every day. These are the distribution sites and where they are and the hours that are operating. One piece of good news is that the panic going on in the stores is pretty much ending. Volumes are returning to normal. This is the supermarkets kept telling people all along that they're going to have the food, and yes, they do. So that's going well, and that's actually good for us because now the surplus supply is getting back to the levels that we would need it to be. We hope to see some good news from the state in the coming days. I know that they are working on how they're going to implement Pandemic SNAP. This will be primarily targeted to the families with children in schools that are missing those meals, and so those families would receive SNAP dollars in order to use those at the supermarket to make up for those meals. And we really look forward to that happening because that's going to make a huge difference.
Thank you very much. Brian, let me ask you one other question. I'll ask you the same question I asked Juliet. What is your biggest worry as you move forward around all of this, Brian?
So the charitable sector, we piece together whatever we can get. That's how we operate. And you're trying to juggle balls and get them so they reasonably line up. And it's really difficult work under normal circumstances. It is so much more difficult now. I'm worried about our partners being able to maintain this level of intensity. I'm worried about, can we keep the supply going? I'm very worried about funding. The reality is we get it, that people are worried about their own finances at a time like this. So it's kind of difficult for them to say, I'm going to make the commitment to help the charitable community. But there are just so many challenges and it only takes, one of those components to fall down and we can't do what we need to do.
Yeah. Do you anticipate these long lines that we've seen? Pasadena ISD had long lines, and we've seen a lot of lines at the food bank and other pantries. Do you see this sort of continuing for the time being? The supermarkets seem to have their shelves restocked.
Yeah, we were not seeing the lines because of the supermarkets. Now, there was some panic in there, but it's mostly people like low-income families, very legitimately. They're the ones on the margin. They're the ones most likely to take the hit, and they don't have, by definition, they don't have reserves to fall back on. So no, we do not see these lines going down. It's just, what is our ability to keep helping until we can go back to normal levels? But I don't see that happening for months.
Very good. Brian Greene, CEO of the Houston Food Bank. Thanks, Brian, for being here today.
Thank you.
Very good. I want to bring up Steve Ives, who is the CEO of the YMCA city. Steve, how are you bearing through all of this?
We're doing okay. I like being around people, so this is tough for me.
I know, it's very tough for me as well. Tell us a little bit about the perspective from you guys for the press in regards to what's happening, especially with low-income kids and families.
Yeah, I want to share that I'm particularly concerned about our most vulnerable populations because they're more likely to be experiencing or have experienced adverse childhood events. And this is a time where they become even more vulnerable. Those that wish to do things to children that are adverse to them tend to thrive in environments like this where folks are popping up fast responses, or families are looking for neighbors or others to help take care of their children. And so we're doing the best job we possibly can to expand our capacity. We've kind of thought about this as a respond first and then reimagine, because there's going to be great needs in the weeks ahead, and there will be in the months ahead around education, around safety for children as people go back to work. The informal childcare network is a fabulous foundation for people to be able to have care for their children, but it also creates a lot more risk for children going forward. That's a concern for me and for the YMCA. So we're looking at every way that we can reuse our buildings and our capabilities and the strengths of our staff team to be able to provide not just safe from health standpoint, but also safe from the standpoint of how people who tend to infiltrate systems like this, who really their desire is to cause harm to children. And we're going to do our best job possible to inform the community about that, but also remind folks who are making decisions on behalf of their own children to be thoughtful about the way in which they get the care that is necessary.
Steve, can you give us an idea in terms of what you're seeing and what you're worried about when it comes to some of these kids that are falling behind, some of the inequity?
Yeah.
And what we should be doing as a city that you can see addressed directly?
Well, there's an awful lot of children right now that don't have access to the internet, don't have folks at home who can help them figure out how to navigate all of that and learn from home. They already were behind for various reasons, and now they're falling further behind. And I think that's a grave concern for me, and I think should be for our community. It's part of the reason we're even rethinking how our summer turns out for this summer, because we made it to deploy some of our buildings and some of our camp assets as educational opportunities for children. And clearly, as the school system changes its timing, perhaps changes the whole rhythm of how we do our programming. So I think those kids, especially on the learning curve, that are falling behind, as you said earlier, I think that's very, very important for us to be not just thinking about, but actually taking action around. And as Brian alluded to, resources aren't at a point where they're greater than they are. We're going to have to count on partnerships, on our ability to work together as agencies. We're going to have to count on some of the people who have more capacity to step up in significant ways to fuel making sure that our children don't fall further behind.
Steve, thank you very much for all that your team is doing. I know that you guys have been through quite a rough patch as well over at the YMCA, but you guys are a great asset to the city. Thanks for everything that's going on with you guys, and keep up the great work.
Thank you. It's a pleasure to serve.
Very good. Next up, I want to bring Colleen Dippel. Colleen is the CEO of Families Empowered. Colleen, you doing okay? You holding up okay?
I'm okay. Working to school full time.
Very good. Well, take it away, Colleen.
Great. So Families Empowered has reached out to 90,000 Texans, and 60,000 of those parents live in the Houston metro area. And we've provided some educational resources and are also fielding calls from parents. And so we're hearing a lot of need from all different places. But I'm going to echo what almost everyone else said. We really need to address what we're seeing as an education opportunity gap for students who are economically disadvantaged. So, you know, we would agree, we're in 100% agreement that we need to get connectivity to all students. We need to get both hardware and connectivity to kids, because we know not only educational support, but they're getting connected. And so those connections and those check-ins are really important, especially for our most vulnerable students. And then the second thing that we're hearing from parents, believe it or not, is when is school going to start up in the summer? So the issues that were raised around starting the school year earlier are really first and foremost on parents' minds for two reasons. They're worried about educational gaps, just like, you know, those of us that, who are participating in this coalition are, and they want and need to go back to work. And so eventually parents will have to go back to work. And for many, many, many parents, they want their kids in a safe, structured environment where they're going to provide with resources like food, having caring adults, and meaningful work to do. So yeah, that's what we're hearing from all of the parents we've reached out to.
I know that you and I have talked about this, Colleen, but what has been the biggest concern on the part of parents that you've run into? There's so many issues going on with parents, right? Teaching for the first time, their own stress levels, not even discounting the kids' stress levels, but parents' stress levels. For you, what has been the biggest issue that you've seen?
So parents right now are under enormous, enormous stress. And the stress ranges from food insecurity to housing insecurity to education worries. I think really needing guidance, parents need guidance about what they are really expected to do with respect to school. And I think our schools are really stepping up in provide that. But lots of people are missing out because they don't have access to technology. And so I think what this coalition is doing, and as Juliet said, coordinating resources so that we can quickly deploy resources, because the stress parents feel becomes the stress that kids experience. And so, you know, I can just say that the stresses we're hearing are very, very across the board and pervasive.
Yeah, it's a tough time for everyone, isn't it? I mean, it's just, I heard someone say that the new normal, but let's get back to the old normal, because this is very, very difficult for us, right? So, Colleen, thank you for all that you and your team are doing. Thank you so much.
Yeah.
I want to, let's continue with mental health. And I want to bring in Renae Tomczak from Mental Health America. And Renae is the CEO over there. Renae, you and I are like brand new to all this technology, but I see you're on, so that's really good.
Yay!
So give us an idea of some of these key issues around mental health that we're seeing with our families and children.
Sure. So the self-isolation and social distancing certainly is necessary to help flatten the curve. But as this time is extended, it's going to cause unprecedented stress on everyone, including the children. So as with any stressors, in young children, you're likely to see clinginess, nightmares, tearfulness, temper flare-ups, not just in your 2-year-old. And depending
It looks like we've lost Renae. Yeah, it looks like we lost Renae, some sort of technology there. Let's see if we can get back to her in a little bit. But right now, I wanted to see if Dr. Gordon from Legacy Health might be able to say a few words. See, you're here, right?
I'm here. I'm here.
You're good. So health is sort of one of the big concerns right now. What are you seeing at the Legacy Centers? And what are you most worried about when it comes to kids? And I'll let you just take away your remarks.
Awesome. So my name is Dr. Tiandra Gordon. I am the Director of School-Based Behavioral Health with Legacy Community Health. During this time, Legacy's programs and services remain open to the community. We continue to see patients during this crisis, but in order to kind of support the social distancing and still provide care, many of our service lines are moving towards telehealth options. So especially because we have 21 school-based clinics, and so those are closed due to the school closures. So we've moved completely towards telehealth and pediatric behavioral health and pediatric health. So I oversee a team of 23 therapists that have moved to this capacity. In the last week, we started last Tuesday. And what we're seeing in kids and families, I surveyed them because I just wanted it to be like just their authentic experiences of what they're seeing in the kids that they're seeing. We found that many students at this time are experiencing a little less anxiety because a lot of times that anxiety is associated with social situations, with academic stressors. So that part of it has been minimized. But high school students have concerns regarding promotion, regarding graduation, wanting to make sure that their efforts are acknowledged and that they're not having to start over in a lot of ways. Many students are missing their peers. They're missing that social interaction. They're talking about difficulties with sibling conflict and challenges at home, but are feeling safe overall from the virus because they've been in their homes. They express concern about grandparents and parents that are going outside the home. So these are generalities, of course, because each family's experience is unique. We've also seen families talk about challenges with finances, concerns about filing for unemployment, so stressors in that area. But the strengths and challenges of each family vary. Families have expressed gratitude that our therapists are reaching out and that they're able to continue to provide care throughout this crisis. We're able to connect with students in a new way. So there's kind of a bright spot in all of this. Through teletherapy, students are able to show us their pets and their siblings and their favorite toys. So we're just trying to find kind of the bright spots in this experience. And we're also able to connect with parents in a little more sustained way. So through this, I encourage families to keep up with your regular appointments, to obtain counseling, stay engaged and connected with your kids. And if you notice major changes in their mood, in their behavior, like they're suddenly withdrawing, isolating, being unusually irritable, reach out for help. Decision makers and community helping organizations, as discussed earlier, can support by ensuring that families have laptops, have access to sustained internet services, to quality, reliable internet services. So both our providers and our patients at this time are kind of adjusting to this newness and seeking to find hope and silver linings.
Thank you very much, Dr. Gordon. This message, right, of this stress that parents are getting now, it's almost like we need to reassure them it's okay that you're having all this stress, but you need to deal with it as well, right? And the other point that I thought you made that I thought was interesting is that sometimes when there's all this stuff going on, we discount the child who missed the prom or the dance or graduation. You're like, well, it's not as big. But you have to remember, for those kids, and you know this, right? For those kids, this was it. This is their big thing, right? And when you hear about college graduations where that are discontinued and you're just going to get your graduation in the mail, you know, if you're a first generation college student like I was, that's a huge deal, right? It's anyway. There's a lot of stress.
I agree. I mean, these are things that that the kids have been working towards for many, many years, been dreaming about, looking forward to. So it is a significant loss.
Yeah, Western culture and all our movies are built around those little highlights in the life of a teenager sometimes. So very good. Dr. Tiandra Gordon from Legacy Health, thank you very much for all that you and your team are doing, right? I mean, you guys are staying pretty busy, so thank you very much. We're going to be able to edit Dr. Greene Lathan. She's doing something, and we're going to be able to put it into the press conference, so we'll get that in a little bit. But let's go ahead. Para la prensa latino, para la prensa en español, Jael Ross está con nosotros. Jael, ¿cómo estás?
Hola, doctor Bob. Muy
Buenas.
bien, aquí, gracias.
Podemos hablar un poco de todo de que hablamos aquí, todo lo que dijeron los expertos. Para usted, ¿qué piensas son las cosas más importantes que quieren saber los padres que están viendo aquí?
Claro. Algo muy importante que me parece se repitió varias veces durante la conferencia de prensa fue que estamos todos viviendo un momento vulnerable, ¿correcto? Que es algo que se comparte en todos los niveles socioeconómicos, en todas las profesiones, entre todos los padres. Hay mucha incertidumbre y nadie sabe realmente qué va a pasar y cuándo va a terminar este episodio que estamos viviendo. Para las familias hispanas, para las familias migrantes, estamos viendo, igual que muchas otras familias, inseguridad financiera, inseguridad alimenticia, inseguridad de vivienda. Otro tema recurrente y que estamos escuchando mucho es la falta de acceso a información y la falta de acceso a información en un lenguaje que nuestras familias migrantes puedan entenderlo. Hablábamos, por ejemplo, con una pediatra el día de ayer que mencionaba, estando en Texas Children, por ejemplo, que muchos papás no entendían por qué las escuelas se han cancelado, ¿no? Entonces, otra vez, la importancia de que los medios de comunicación, que nuestras autoridades locales y federales sigan transmitiendo mensajes claros, mensajes en español y mensajes en los idiomas que necesitemos para poder transmitir un mensaje claro a nuestras familias migrantes. Algo que dijo Colleen Dippel que me pareció muy, muy bien dicho fue que el estrés que están viviendo, el estrés que están sintiendo los papás, es el estrés que nuestros niños están experimentando día a día. Entonces, otra vez regresar al primer punto, en que todos estamos viviendo un momento vulnerable, en que la incertidumbre es compartida, adueñarnos de este sentimiento y poder compartirlo con nuestros hijos, compartir que la incertidumbre es compartida, que no solamente ellos viviendo un momento incierto, pero que hay que ser resilientes, hay que sacar todo lo que podamos para lidiar con este momento de la mejor manera y reconocerlo, ¿no? Reconocer que todos estamos compartiendo esto. Y otro tema muy importante es el acceso a recursos como tecnología. Mientras muchas familias pueden seguir con la educación en línea o conectarse o entender lo que está pasando en las noticias y en el día a día, otras familias no se pueden dar el lujo de no ir a trabajar, no se pueden dar el lujo de aprender en línea, ¿correcto? Cuando no tenemos computadoras, cuando hay un celular por familia. Entonces, otra vez es recalcar esto con nuestras autoridades, pedir más apoyo y pedir más información. Y no descartar, no dejar de mencionar esto hasta que las autoridades nos apoyen un poco más, los medios de comunicación también, en transmitir mensajes claros y asegurarnos de que más familias tienen acceso a estos recursos.
Yo hablé un poco sobre qué tienen que decir nuestros líderes sobre la comunidad latina y el salud y el COVID-19. ¿Puedes hablar un poco en español sobre qué queremos de nuestros líderes para que todos tienen buena salud hoy?
Claro, necesitamos que nuestros líderes den un mensaje claro en que si tenemos síntomas, si no nos sentimos bien, es seguro irnos a revisar y es seguro ir a clínicas de salud. No importa nuestro estatus migratorio, ¿correcto? Nadie debe de preguntarnos ahorita cuál es nuestro estatus o ninguna clínica deben de pedirnos por papeles. Todos debemos tener el derecho a accesar el test y saber si tenemos COVID o no, para también proteger a nuestras familias. Otra vez, es importante recalcar, es importante que nuestros líderes aseguren ambientes seguros y aseguren tener este mensaje claro en que todos debemos poder ir a checarnos. Nadie debe preguntarnos sobre nuestro estatus migratorio. Es seguro y debemos hacerlo. Yo los invito a que, por favor, si no se sienten bien, si tienen alguna duda sobre su salud, vayan sin miedo a una clínica de salud y no deben estar nadie preguntando otra vez nada sobre su estatus migratorio. Y es otra vez trabajo de nuestros líderes locales, estatales y ojalá federales también, ¿correcto? Y de organizaciones que nos transmitan este mensaje de seguridad y que otra vez lo transmitan en un lenguaje que nuestras familias migrantes lo entiendan. No únicamente en inglés, en español, en el idioma que sea necesario. Es seguro ir a revisarse y debemos de hacerlo.
Gracias, Yael, por todo lo que estás haciendo, por todo de usted y su equipo, Children at Risk, porque todos están haciendo mucho. Gracias por todo. Y necesitamos que la información continúe para todos, para nuestras familias latinas también.
Gracias por abrir espacio para las familias migrantes.
Hey. And that brings our press conference to the end. I know that many of you will want to do individual interviews with some of our speakers, and they are they're very interested in doing these, whether that be over FaceTime or other ways, Skype or Zoom. They are more than happy, and we can provide all of that contact information for you. This is an important issue for all of us. And we thank you for listening. This is an important issue, not for all of us, not just for all of us, but for our entire community. Thank you very much. And we look forward to providing more information in the near future. Take care.